All right, everyone. Well, we'll go ahead and dig in here. Looks like we've got about 30 people on board, and we may have some more showing up in a bit.
I'll keep an eye on
Well,
the chat or the waiting room.
thank you very much, Kim. Very much appreciated. My name is Lynn Lucas. I work with the early childhood team. Kim Coffrin is co-presenting today. She is the executive director of early childhood education at Children at Risk. You probably all know her already, but hey, the reintroduction's never a problem, right? So, well, welcome to all of you. We're so glad to see you here today for the April 2026 Spring Texas Tour. And many of you we get to see at all of the Texas tours. We appreciate that. There is always new information, and today is no exception. So we look forward to diving into the work with you here today. Our mission statement at Children at Risk is to serve as a catalyst for change to improve the quality of life for children through strategic research, public policy analysis, education, collaboration, and advocacy. And we appreciate all the work that you do in your communities toward those efforts as well. Here is the rest of our team at Children at Risk who helps to support the early childhood work both behind and in front of the scenes. The Texas Prenatal to Three Collaborative welcomes you. Please grab this QR code if you're interested in being invited to quarterly meetings and receiving the P&3 specific newsletter that has information that I bet is relevant to all of you. So grab that. You will, by the way, get a copy of the slide deck. And so if there's anything that you're not able to quite grab onto during the presentation today, don't worry, you'll receive a copy of that later. Today's presentation will focus in three different sections. And so first, we'll talk about quality, and I'll escort you through that part. And then Kim will escort you through both a section about access, which includes childcare deserts, and then through the last section, which is policy. Please note that your interaction is so important to us. We love to have interaction from you. And that at the end of each of those sections, there will be a Zoom poll. The first two are just going to ask you to rank in order of the greatest barrier or challenge, a few things. And the very last one is more of an open-ended discussion item that's in the policy part. We hope that you will participate in the polls. You are also welcome to put things in the chat or to come offline and just ask a question or make a comment out loud. We welcome all of those different ways to do this, to contribute to our time together today. Whoops. So let's talk about quality dollars and how those were invested in the 2025 fiscal year. This is the local workforce boards, which ended in September of 2025. So what we're looking at here is,
Lynn,
yeah.
sorry, it was 2024.
Oh, thank you. Thank you for that. It says right there, 20. I
Just
don't
so
know.
people don't get confused.
Getting to
We're now just collecting the 2025 data. So
24. Thank you very much. And so what we see here are the investments in comparing the board calendar year 2023 to 2024. And what we see here is that 2023 is in red and the 2024 results of expenditures are in gray. These are specifically the quality dollar funds, which help to support the subsidy programs that are engaged with Texas Rising Star specifically. And so we can see some of the differences between the way that Permian Basin local workforce board spent these dollars. And right away, you can see that there was a big shift. So in 2023, 68% of those funds were spent in professional development. So there was a lot of investment in that area. And then you, as a community, you probably looked at those results, and the workforce board was trying to figure out, okay, now how do we need to invest these dollars? Something that happened in 2024, as you may remember, was the mandatory engagement with Texas Rising Star. And so kind of toward that effort, we can see that in 2024, 70% of those quality dollars were spent on Texas Rising Star supports. There was also some spent in health and safety, other infant, toddler, and professional development. I do think that other and the infant, toddler portions on here, it shows enough of an increase that you look at that and think, okay, interesting. There's some purposeful things happening. So it appears that there was some specific infant, toddler investment that was important to you as a community, and also some investment in the other. I do want to go ahead and point out something that's interesting because we have a chance to look at all of the workforce boards, and you can too, because a report is available to you with all this information in it, including every workforce board's detailed info. But the other category was the one that we saw the greatest change from 2023 to 2024. In a minute, you'll get to see how your investments in 2024 compared to the state overall, which is also an interesting point of discussion. Speaking of the state, here we can see the Permian Basin, which is in red, compared to the state expenditures in 2024. And so notice, for example, that other category, 35% of the state overall invest 35% of the dollars for the state overall was invested in this other category. What is in the other category, you ask? Well, we will get to that in just a minute, don't you worry. So these are actually the broad categories: infant, toddler, professional development, Texas Rising Star, evaluation assessment, national accreditation, and other. Those are the broader categories, and there are subcategories underneath each of those. So we'll dig into that in a minute so you can see specifically what's in other, what is in Texas Rising Star, what is in professional development, infant, toddler, etc. So you can see here that as a community, Midland-Odessa, you invested a lot more in Texas Rising Star than the rest of the state did on average. You also, even though you spent a lot less in professional development compared to what you spent in 2023, you still spent more than the average state number amount. So that's interesting. Infant and toddler, same thing with infant and toddler. No, reverse, not infant, toddler. My apologies. There was a lot of investment, additional investment this year in infant, toddler for many other communities. So let's take a look and see what that looks like overall. So this will show some of the sub items. Right after we go through this slide, we'll see some of the sub items. So this one's comparing the larger category across all of these different, all the different 28 workforce boards. You are in red, and you can see just the icons represent not how much was spent, but that money was specifically targeted in the different category areas. And so you can see for Permian Basin here that you invested funds in professional development, infant, toddler, health and safety, and then other. Looking across the board, you can just see some workforce boards invested like solely on one item. Borderplex, for example, you can see they invested like a lot in infant, toddler, and then professional development, while others like Capital Area and Texoma invested in each area. So now we're going to look at some of the subcategories. This first one is letting us know what are the subcategories to Texas Rising Star supports. Well, they're equipment, materials, curriculum, outdoor learning, the mentor salaries, additional funds into mentor salaries, family engagement, and TechPeds SME, which is the Texas Early Childhood Professional Development subject matter expert. And so do note that even if you don't see it specified on here, all of the workforce boards had support to some degree in this area. You know, people code things a little bit differently sometimes, but it's important to note that the way that the workforce boards choose to code their expenditures a lot of times really help us understand what the focus of the community is in terms of that purposeful movement toward improvement. So Permian Basin, your TRS supports were in equipment, materials, resources, and also in curriculum. So those are the areas that you invested in. In the infant and toddler category, Permian Basin, you invested in professional development. That's where all of your infant toddler really focused in on professional development. So it's interesting because when we look at professional development here, we can see that that was another area that you also invested a whole lot in. And so professional development, whether it was infant toddler specific or in this other area, was something that was considered an important investment for all of you. Back to the infant and toddler slide, just to give you a moment to see what the other workforce boards did in this area. You can see that this also included opportunities for expansion grants or making sure that there were some investing in additional infant toddler classrooms, outdoor, which is usually outdoor equipment and some specific things of that nature, the infant toddler specialist network, and then evaluation and assessment. Back over to professional development, there are a lot of things that happen within this category. And so it could be trainings or conferences, it could be CDA support, orientation for Texas Rising Star, college scholarships, or apprenticeships. And so different workforce boards invest in different ways. Permian Basin invested mostly in trainings and also in conferences. So you can give some thought to what kinds of participation investments did your program or area be able to participate in? And did that work for you? Do you have feedback for your workforce board? How are these investments working out for you and your program and your community in terms of outcome? The other category, that's the one that a lot of times people think, well, what in the world is an other, especially because so many more, there was a lot more investment in the other category this year, in the 2024 year. And so these are primarily in three different areas: wage supplements, pre-K partnerships, or childcare management systems. Interestingly, Permian Basin, you all focus on the childcare management services, which is great, like super important component of being able to do good business work and managing those accounts. And there's a lot that can be done actually with those systems. And so I think it's super important to be able to invest in that. Most of those funds, however, across the state were invested in wage supplements in all kinds of different ways. What we saw most often is that those were given to programs or individuals when they met certain quality milestones, like Texas Rising Star level 3 or level 4 star level arrival. Access to quality care. This is looking at what the TSR ratings were, and what we see from the bottom to the top. Down here, it's what did Texas Rising Star 2 look like in Permian Basin between the 2023 and 2024 program years, calendar years. Then we see the Texas Rising Star 3 level, and then it goes to Texas Rising Star 4 level. And so, wow, it looks like you in quality, in the quality care, Permian Basin, you had a lot of programs come on into Texas Rising Star in that year. Look at how much that increased. It's huge. So a lot of onboarding in that year, which really reflects the efforts to reach those mandatory levels of participation. You also had a big jump in the number of Texas Rising Star 3 and also in the number of Texas Rising Star 4. And so maybe a question is, okay, in the 2025 year, then what does that look like? And so that's the year that we're in currently. And so does that look like these Texas Rising Star 2s jump up to 3 or 4? Do we want the Texas Rising Star 4s to be able to maintain? So those are some questions to have in your community on what's happening next. And then, of course, any additional programs that aren't Texas Rising Star yet, entering into that program. Thank you, Kim, for dropping the full report in the chat there. You can also find this full report by clicking onto that QR code. This report gives a good executive summary of these dollars and a little bit of analysis behind it. It also gives you not only the Permian Basin specific pages, but access to all of the individual local workforce board area pages if you're curious about looking at in detail at any of those. So now we have a question for you, and we want to know what you think about childcare quality in your community. And so toward that effort, we're going to put up here a poll, and we're going to ask you to rank order the list of things here. Which one of these things do you think is the biggest barrier to quality in your community? So that will be the one that you list for the biggest barrier. And then so on and so on, which is the biggest, which is the second biggest, which is in the middle, which is second to smallest, and which is the smallest. A Likert scale was not an option in this poll, which is why it's being given to you this way. So please take a moment and answer those for yourself, and then we'll share the results with you.
And as you do that, if you have any questions about the data that Lynn just shared, feel free to drop it in the chat or just come off mute and ask. Happy to have some dialogue.
Absolutely. Thank you, Kim. I'm gonna wait just a few more seconds to get a couple more of these in. Okay, I'm gonna go ahead. We have just over a little bit more than half, so feel free to keep on keeping on there, but we want to be able to show these to you so we can kind of move on the rest of the discussion. This shows you the blues are the ones that we add together just to kind of look and see really quickly which ones are the biggest barrier. It appears very clearly that in your area, salary and benefits, you feel like that's the biggest barrier to quality. The next thing is the quality level of the applicants. So that's something to really think about how your community is addressing those. Almost tied, are the quality or access to professional development and overburdens with administrative work or paperwork. And then lastly is maybe still an issue, but not as much of an issue as these other things, are the licensing related issues like turnover of representatives or access to information. Any comments or questions that anyone would like to make about those results? Something to kind of to think about is realizing that those are some of the biggest barriers to quality, is just to ask yourselves, okay, these are the biggest barriers. Are we doing things in our community that might help respond to those barriers? And if not, then what could that look like? So with that, I'm going to pass it on over to Kim to talk about access to quality childcare. Kim?
Good morning, everybody, again, and Lynn's going to pop up our slides. So hopefully you are familiar with our childcare deserts and our data. We've been collecting it now since 2017. And really, it gives us a chance to really kind of look at a statewide approach to our deserts and kind of gives us a snapshot and some landscape about what's happening. There we go. We have traditionally looked at three levels of deserts, and this year we've added a fourth. So our traditional childcare deserts are that first one is it's a zip code where there's at least 30 children, and where the demand for childcare is 3 times more than what the available childcare seats are available. That's all children childcare across the state. Everybody and anyone who's licensed in our is open for business, as well as all children under the age of 5 of working, where all parents in the household are working. The next level is subsidy, and this is looking at our low income families under those same parameters. So again, a zip code, at least 30 children, but now we're instead of looking at all children of working parents, we're looking at low income families that have children under the age of 5. The third level is our Texas Rising Star level, and this is really looking at our quality within that subsidy system of low income. Now we're drilling down into our Texas Rising Star, our quality level system, again, within those other same parameters. And then this year, because we've been tracking this data since 2017, we now have some longitudinal data. And so we looked at and we are far enough away from the COVID dip and bounce that we can now look at what the data is telling us, and what is a chronic childcare desert. And then chronic childcare desert is a community that has been a desert for at least 3 consecutive years. And what that really tells us then too is thinking about a child's life in that 0 to 5 space. 3 years is obviously a big chunk. This is more a sustainable or systematic issue and barrier for those children and for those families. So let's take a look at the first level. And this is our overall childcare deserts. What's in gray and brown on your left is statewide data, and then what is in red um, uh, is our Permian Basin, specifically looking at the Permian Basin Workforce Board. So overall, the state, we have about 995,000 seats across the state. We have 413. Those seats are up from last year by about 3,000 kids across the state, which means our deserts went down. And we had about 420 deserts last year, and we have about 413 across the state this year. Relatively good news, and we're going to get into some nuances of that because it's not all uh, bells and whistles. And then when we look at Permian Basin specifically, you two are up a little bit of seats. You guys are up just about 1,300 seats across your region and about 14,500 seats. And your deserts are at 15. Last year, you guys were at 17. Again, looking at the overall, all children, all families. When we drill down to subsidy, we see a little bit of a different story. Um, so we do see an increase in seats both in our subsidy and um, our subsidy and our sorry, we see an increase of subsidy seats in our uh, for Texas as well as Permian Basin. That's the sentence I wanted to say. Maybe I need some more coffee. But we also see this increase of deserts, and so we really kind of wanted to dig into like if our seats are going up, why are our deserts going up? And what we kind of found was, oops, we're skipping ahead. What we kind of found in both our um, subsidy areas as well as our Texas Rising Star, we found three real reasons that happened this year that are somewhat are new to us. One is the demand appeared the demand appeared in previously unclassified zip codes. So remember, I said a childcare desert is a zip code where there's at least 30 children. So it's very possible that in some of these regions, in your region, that those zip codes weren't a desert last year because there wasn't 30 children in that zip code, but now there is. And so that's one reason. Another reason is the demand outpaced the capacity of growth. So you added more seats, but you also added more children in those existing zip codes. And then also we just have seen some supply loss. We've lost some Texas Rising Star providers for various reasons. They either have closed their doors or they have no longer taking subsidy care. So those are things like it really depends on we are adding more seats, but we're not necessarily adding them in the right areas, or the demand has just outpaced the growth. Um, And you can see that too in our Texas Rising Star levels as well. Again, we've increased, Glenn showed you that chart earlier, and that continued in 2025 of more programs getting on TRS that were in subsidy, which is fantastic. That means more children are being served in quality. But that also means that the demand is outpacing the growth. There's more low income families that need it in those various communities. Then we take a look at the chronic. So this is new data. We've never looked at chronic deserts, like what, so we're not doing a year over year comparison yet. But this is looking at all three of those. So that first one on your left is overall deserts, the middle one is subsidy, and the one on the right is Texas Rising Star. So out of all of your deserts, seven of your deserts and overall chronic or excuse me, seven out of your let me pull this one over here and I'll tell you exactly what those figures are. Seven out of your 15 overall deserts are chronic, have been deserts for more than 3 years. 12 out of your 21 subsidy deserts, or 57%, have been a desert for more than 3 years. And your Texas Rising Star, um, um, 55%, 44 are chronic deserts for Texas Rising Star. So we see that there is obviously a need. And again, when you think about a child's life and think about those first 5 years, over half of that time, if a child stayed in that zip code from the time they were born through the age of 5, they have not been able to access care in in their communities. So as we think about parents' abilities to go to work and to succeed and have economic freedom, as well as the child's ability to get ready for kindergarten and have them ready for be a lifelong learner. This chart really is looking at number of seats, and this is statewide. This is overall is that top red line. If we look at number of seats per 100 children of working families, we've got 86 seats per 100 children. Not bad. We know not every family needs working families need childcare. They do shift work or have a relative nearby, and that's perfectly fine. So we're doing good at that 86. And really, this chart doesn't show in 2019, but that's kind of where we were in 2019, 2018 before, is that 86. When we look at those bottom two lines, that middle line is subsidy, again, low income families, and then that teal line is our Texas Rising Star. So we have about 26 seats per 100 children. Again, not nearly enough. And about 23 seats of those are quality. Those two lines are getting closer together because we're living into mandatory Texas Rising Star, which means more of our low income seats are now quality, which is fantastic. But we know that those two lines aren't far enough on that chart of where they should be, if we had more funding and more availability for them to actually get to serve more children. This graph looks at the participants of providers in Texas Rising Stars. So if you look at on the left-hand side, this is out of all the providers in Permian Basin that are taking low-income children, that are working with your workforce board, 82% of your providers are now on Texas Rising Star, and that's beating the state average of 77.4% of those providers are now on Texas Rising Star. So you guys are beating the state average as of in 2025 about the number of programs. And look at that big jump that you guys did in the last half of 2025 to really reach those goals. The right side is looking at the number of children. So if you look at all the number of children that are receiving subsidy, how many of them are in a Texas Rising Star program? And again, you guys are beating the state average by just a skosh, where or maybe you're under the state average, actually, I think, by just a scotch, where 82% of the state's children are in a Texas Rising Star program, and in Permian Basin, you guys are at 81%. So pretty much a statistical tie on that, which means more families are choosing quality, and we have more uh, their choices are already at high quality levels, which is fantastic when we think about the children. Family home child care providers is another area that we've been tracking. And we had a slight growth this last year, which is fantastic. But overall, we're still 22% lower than we were in pre-pandemic levels. And we know family child care is a vital um, uh, piece of our industry, especially serving infants and toddlers, especially serving families that have non-traditional hours and need after hour care or weekend care or early morning care. And then we also know families choose a home-based for family and logistics reasons, and so we want to make sure that they are available. So we can continue to keep an eye on family childcare as they're a vital piece of our landscape. Overall, when we look at just the 0 to 5 population, we have just over 1 in 4 low-income children with working parents receive subsidies in childcare. So when we look at our funding and look at the need, we're about 26% of our population for low-income families have the funding, have enough scholarships to be able to get childcare. And we know that's not nearly enough of what we need that to be. But that's currently where we are at. All right, so it's my turn to take a breath, answer any questions that you have about data or want to dig into something. And then while you guys are thinking of those, and feel free to come off mute or drop something in the chat. And then Lynn's got another poll as well. So this one's really around access to childcare and rank and order. What's your biggest barrier in your region when you think about what families um, uh, have access to childcare? I love seeing the graph. You guys can't see it yet, but we can see Lynn and I can see the graph shift as people get their votes in. We'll share here in a second, but when I make sure people have time. It's almost a three-way tie. Dun dun dun. Okay, I see voting kind of stopping, Lynn. So you want to go ahead and share? All right, so no surprise, not enough staff is, I think, when we add in, um, we always, like Lynn said, we always add those two blue lines together because that's the first and second. Um, uh, when you add in both of those together, not enough staff is in the lead, but not by much. So thank you for your input there. And then the second one is the cost of care for families, right? So which is directly related to the cost of doing business. Because if the cost of doing business was less expensive, we could make it cheaper for families. But we know that's expensive um, as well. And then location of programs comes in the least. So and really thinking about that enough staff. Um, how to just again that larger conversation of how do we attract more people to the field and into this work. All right. Any questions or feedback on the data? Oh, you know what, Lynn, I forgot to do before we move on completely from this. I want to share the map. Um, I want to give you guys a little tutorial around the map. So this is our childcare um, desert map that you can uh, pull up on your computer and play around with. This is the landing page, and you go into View Maps. Takes a second for it to load. But when you get in here, you'll be able to toggle and look at your community specifically. Um, Here we go. So this is our map, and it gives you the statewide view to begin with. A couple new features this year. we've added this component to the right, which is the number of chronic deserts across the state. And so we've got 263 deserts across the state that have been a desert for at least 3 years. When you look at the visual of the map, you can see that dark line around some deserts, and that indicates that that is a chronic childcare desert. On the left-hand side, this teal button, you can unhighlight it and the chronic deserts go away. So if you don't want to look at that, you can toggle that piece. You can put it back, you can see the lines. And then you can also um, uh, click on this button and it will give you a more of a heat map of looking at your area. You can kind of drill down into those. There's the different programs. You can also select all programs that take CACFP or toggle out for not CACFP, and you can mess around with those as well. So I'm going to take those off for now, and then I'm going to choose Workforce Board Area and Permian Basin. So this is your region. So you can kind of see where the outline of your map, and then you can also look up here and see that across the board, there's your 14,500 seats. On average, it's 70 seats per 100 working families, 15 deserts, and 9 chronic. Then here you can go to your subsidy and drill down on that look for your low income families. And then you can also look at your Texas Rising Star. And again, you can drill down, you can highlight over a desert, and it will give up the zip code, um, number of children of color, what level of desert it is, pre-K seats, Head Start seats, etc. You can also, I'm going to go back here and go to total. Um, and then, oops, I didn't mean to zoom in. And then the last thing I want to show you is you can also do over time, which gives you a comparison to Permian Basin and the state. Since we started tracking the data in 2017. Obviously, you can see the big dip is COVID. Um, and then you can also download data. So if you are wanting to dig in and look at data for your region, over here you can also do different boundaries for county, school district, etc., Senate and House districts. And you can zoom into whatever area you're looking at to really make it useful to your needs. So just wanted to give you a little quick um, review of our map that will we get excited about the child care desert because we can look at the state, but we also get excited when local communities can really dig in. You guys know the in and outs of why a zip code's a desert or not. That I don't necessarily understand because I don't live in your community. That way you can really dig into that need. Okay, with that, and again, feel free to come off mute and ask questions or drop it in the chat if you so wish. So the last section we're going to talk about is our advocacy group, our advocacy work, and really thinking about where we are. Just kind of level set us. 47% of our zip codes across Texas are considered childcare deserts for low-income families. We know cost to families is high. For infants and toddlers, costs can be 10 to 50% for working families. We know that the recommendation is for childcare to cost no more than 7% of a family's income. Our educators are also important to look at, as you guys threw in your survey. Excuse me. EC workforce is 6 times more likely to live in poverty than our elementary or middle school teachers, and 43% of our early childhood educator households participate at least in one or more public safety net program. And so that would be SNAP or insurance, etc. When we think about our ecosystem, you guys have seen my tricycle before if you've been to one of our Texas tour stops. This is kind of how I talk about our complicated systems that we have. Our deserts look at that for that back wheel, the brick and mortar facilities, like really where are our seats, where are the buildings, where are the children? Like really counting those, and that's an important piece of our wheel. The front tire is our early childhood educators, which you guys lifted up as a huge need in your area. And we can have all the beautiful buildings we want, but if we don't have educators those classrooms are going to go empty. As we know, many of them currently are sitting empty. And then we have that back wheel, the back far left wheel is our affordability. And again, we can have beautiful buildings and we can pay the educators that they need, but if it's not affordable to parents, parents are going to choose other options. But also those all work together, right? We can't have one without the other. The rules and regulations are really the framework. It's what keeps us together. It keeps us what licensing said, what TRS says, what public schools say for public pre-K, what Head Start, all of those things combined are our rules and regs. Sometimes they're aligned, sometimes they're not, and it makes it more challenging for you as providers and for people taking care of children every day. Um, Funding is our pedals. That's what keeps us moving forward. We can only get so far with so much funding. We know we need more funding in the system. We have 2.3 million children under the age of 6 in Texas. I always say we are not fighting over children, we're fighting over funding. If we had enough funding to serve all the children, we would all of our doors would be full. And then obviously each of us are in the driver's seat to make change. So kind of keeping that framework in mind, what is that? What is our tricycle in Texas? And our tricycle, when we think about those rules and regs, is really over six different state agencies. Obviously, Health and Human Services, that's who houses child care regulations, among other things. Department of Family Protective Services, that's our child abuse and neglect statewide intake. If you're caring for children and you're everyday capacity. We have all interacted with DFPS at some point. We have Department of State Health Services. Obviously, that's maternal child health, but also our immunization trackers. And then if you take subsidy, you're also working with Texas Workforce Commission through their child care services that has the subsidy scholarship programs, as well as our Texas Rising Star, which is our quality rating improvement system program. Then if you take subsidy, you may be taking the CACFP because you have enough kids in your program, which is our child and adult care food program that helps pay for food. And then if you have a partnership with pre-K, you're also working with TEA. And so right now, our governance structure is across all six of those entities, touch all of those entities. I, as a child care director many moons ago, had touched all of these agencies, and it can be very consuming and overwhelming for providers as well as for families. With all that in mind, a couple things are happening. Three things specifically. We have House Bill 117, which that passed last legislative session. Both that and House Bill 4903 passed. It creates a governor's task force on early childhood education and care, and really try to how do we make those six systems better aligned, and what could a new vision of that look like that would be better for those of us that work with children every day, as well as for families and children themselves. House Bill 4903 what set up the Quad Agency Child Care Initiative Commission. This is really looking at the standards specifically and the regs specifically. Where is there duplication? Where is there overlap? Where are they saying conflicting things, etc. And how can we make that more streamlined again for those providers and hopefully reduce cost to those providers? And the third thing that's happening is the Sunset Commission, which is a commission that looks at all state agencies, and they rotate through all the state agencies every 10 to 12 years. And this year, we have Department of Family Protective Services, Health and Human Services, Department of State Health Services, and TWC are all under sunset review. So all these three things combined are really give us an opportunity to make some major changes this year. And so I jokingly say we have either all the stars have aligned for some major change, or we've really made the gods mad. I'm not sure which, but we are in the middle of living through that. So, with all of that in vain, and here's just a breakdown of all the different things that are happening with the different state agencies. But with that in mind, we did a couple things last fall. One, we had a Texas tour where we're out in Midland and asked some great questions and really listened to what you all had to say. And then we also did a survey where we had over 1,300 childcare providers and parents tell us what they are experiencing. So based on those two things, and this is a breakdown of 90% of them were childcare providers, but based on those two pieces of vital information, we were able to come up with a report that was linked, and there'll be another link at the end that you can grab. We have come up with our recommendations. based on the survey and the Texas tour. And the first one really is thinking about that governance, designing a purposeful, unified governance with system-wide coordination to improve efficiency and quality. We need someone with decision-making authority to really say, and to look at the whole child and the whole system and say, this is what's best for children, this is what's best for providers and for families. And we don't currently have that. They're all in their own silos, doing their own thing, not necessarily knowing what the right hand, what the left hand's doing, etc. The second one is really around efficiency, really improving the efficiency by reviewing the local workforce board, service areas and alignment. Our workforce boards were developed in 95, and we as a state have changed in the last 30 years. And so just really kind of looking at what does that make up and what does that need to be to best serve children and families. The third thing we really talked about, what heard from providers, was around the application and families application and access to streamlining, just to modernize our systems that we are holding. Uh, Providing a way to have that common application for families to have a one point of entrance, having portals that they can do a one-stop shop. We've got lots of great information on lots of websites um, across the all of them. But that's hard to find. We had one provider say, I can't, unless I spend hours digging on this website to find this information, I can't find it. And so really just how do we continue to um, build a better system, and really thinking also around eligibility, what qualifies for a program. Some things are measured April 1st, some things are measured September 1st, some are at 200 FPL, some of them use state medium income. So how can we streamline those things as best as possible across the board? The next area is really around recommendations around regulatory and implementation alignment. This is really talking about uh, rules shifting without warning, inspectors applying different rules unevenly. That's something we heard consistently from providers when we were on tour last year. One inspector tells us one thing, another one tells us something different. Um, the sheer number of regulations can be overwhelming. Providers are frustrated with self-reports and how to reach out, feeling like licensing isn't a partner, but more of uh, uh, we're gonna get in trouble if we ask too many questions versus really being a thought partner of how to try to problem solve. Background checks came up on this one. How do we streamline background checks and really build that consistency across the state? The last two areas were around contracting and accountability and performance management, as well as access for children with disabilities. The contracting and accountability really, this theme surfaced strongly across the surveys, especially in connection to the reimbursement delays and the inconsistent contract requirements from the various workforce boards. Described financial administrative systems that feel unreliable, unpredictable, and difficult to navigate. So really, how do we build that better, streamlined system and also hold everyone accountable for those systems, and making sure that's not just all falling on childcare providers, but also falling on the contractors and vendors and the state, etc. That last area is really around children with disabilities and really thinking about how uh, we support children with disabilities. We heard this consistently across work for our tour last year about the rise in children with challenging behaviors and how can we support them and really build an inclusive environment for them. One of the things that happened last year was House Bill uh, 2310 was passed that required TEA, Health and Human Services, and TWC to develop a strategic plan around dealing with children with learning opportunities for children with disabilities. So TEA has just released this um, a new survey looking at early childhood inclusion plan. It is only open until May 3rd, so we just have a few weeks to fill it out. But if you can, let me get the link live. If you have thoughts on how to help families, this is like everything from the transition from ECI to um, uh, public school supports that you need for um, your childcare program and your staff, all of that will um, be helpful in your survey. So there is the link to that. So spread the word on that one. And then I think we have one last poll for you. And this is really thinking about um, what do you think about the public policy supports that we currently have in place, all the things that we mentioned, and anything that we missed. Um, and you can just type your answer in there. Thoughts or questions rise to the top of your mind today about these recommendations. Or you can just come off mute and chat too. That works as well. Any overall thoughts or feedback? This rain's making us all sleepy.
We do just want to thank y'all for coming out and presenting to us here in the Permian Basin. This is good information for us all to have and be able to share out with our partners um, at as we encounter on our daily walks. So thank you, Kim and Lynn, for presenting all this wonderful information today.
You are so welcome, and we'll be out there in person again this fall. And Lynn, I think we have a couple more just closing slides that has a couple more links to just share with everybody. Um, but we'll be out there in the fall, and the Sunset, the Governor's Task Force, and the Quad Agency are starting to meet pretty regularly. Well, Quad Agency and Task Force are we're anticipating the public Sunset public hearings to start in the next couple months. Um, um, Here are the QR codes. That one on the right leads you to the map that I shared earlier. The one in the middle leads you to the quality report that I shared, dropped the links in earlier. And the last one's just our sign up for Children at Risk ECE update. So as opportunities arise, and our newsletters, etc., are all up there. So we appreciate your support. And then lastly, our contact information. So if you have any questions, feel free to reach out. Appreciate you all. Enjoy the rain. Let's just soak it all in but before it gets too hot. And if there's not any other questions, we'll let you guys have the rest of your day.
Thank y'all again.
You're welcome, Katie. Have a great day, everybody.
Thanks, everyone.